McDowell County proves when small towns think differently about rural healthcare, unique ideas come to life. I'm Anita Brown-Graham. This is NC Impact.
NC Impact is made possible by funding from Civic Federal Credit Union and is a public media North Carolina production in association with the University of North Carolina School of Government.
McDowell County faces challenges common for many rural North Carolina counties. But what the county has proven is that when the right group of people come together, good solutions blossom.
So the pilot community that we started working with was here in West Marion, and it just kind of took off from there. We hosted 4 community forums, and the first forum was really all about, well, what is your vision for West Marion? Because a lot of the times you come into a community and you talk about all the problems and you talk about all the challenges, and we really wanted to talk about the assets and the strengths and really take that approach.
When I came into it, I come to just see what it was about, but I got inspired to see what was possible.
What we wanted in bringing a community forum is we wanted to celebrate our similarities. It seems like in this day and age we focus a lot on our differences. So often we sit and wait for other people to bring change to us. Leadership begins within you. And the more people that you bring together, the more change you can bring to your community.
The work that we've done has been across the county, so it's been great to collaborate with all of these forums as they grow, because healthy food, active living is always raised as an issue that they want folks in their community to be healthier.
Our community garden is called the Tabernacle Community Garden. We want to create a space where we can grow food and healthy food for people. But what I've seen in the garden is more of a relationship building. I've seen more people come together and bond, people learning about gardening, people learning about each other, people learning about themselves.
The change is there, the possibility is there, we just have to reach in and all work together to make it happen.
There's this quote I saw on the Berlin Wall, and it says, "Many small people from many small places do many small things that change the world." And that's what we're doing here in McDowell County.
One McDowell County collaboration changed the relationship between first responders and the seniors who are most likely to call 911 for help.
Lucille and I have known each other about 3 years.
So we developed the Community Care Paramedic Program in 2013.
Have you been seeing your doctor regularly like you're supposed to?
The goal of the Community Paramedic Program is to prevent 911 calls from occurring.
All right, you can just relax your arm there.
We know that by connecting patients to the right resources, we can improve their health and decrease their use of EMS services.
Let me take your blood sugar now, okay?
Traditionally, paramedics are responding to emergencies. It's a different transition for these folks to go through, because now community paramedics work on the front side to prevent an emergency from occurring.
I do go to her home normally to see her, but I took her to the doctor before, or went and took her to get groceries or things like that she has trouble doing sometimes.
And we approach every patient with a case-by-case basis. What works for one may not work for another, but we go into it with an open mind, saying, let me get you to the people that can help you.
It means a lot. It sure does. It means a lot. I'm glad y'all can come, you know. I'm glad I'm in this. So it makes me feel better.
McDowell is one of the few EMS agencies in North Carolina that is seeing a decline in our 911 volume, and we attribute that to the work our community paramedics are doing within the community.
I'll come by and fill your pill box, okay?
Okay.
And it's one story after another that we have that really demonstrates the impact that our program, working with many community programs together, is moving the needle.
New technologies are bringing doctors closer to patients. Telemedicine is bringing physicians into schools.
I'm good, thanks. How are you?
Healthy Schools is a school-based telehealth program that makes it possible for kids, as well as faculty and staff, to receive healthcare services where they spend most of their time at school.
Yeah, I've got Luke here. He's not feeling so good today.
We have really good healthcare providers in our community. We just don't have enough of them. And so while they do wonderful work, they might not have enough slots in their schedule. Kids who would otherwise not receive any care have access to care.
Take a deep breath. It doesn't require the kid to be out of class, because they can sit in class and wait for the prescription just like they could be sitting at CVS and wait for it. So we're able to get the teaching done at the same time with making sure that their health needs are taken care of.
Okay. I started school nursing itself 19 years ago, so 19 years ago I would never have thought that we would be doing it quite this way. Oh, the kids love it. They're like, oh, this is cool, I can't wait to do that, or that's so neat, and especially if they get to see inside their ear, things like that. It's like, wow, I didn't know that. So they really like that. Okay, Luke, you're gonna have to pack up and go home with strep positive, and we'll let Mom know to come get you, okay?
It's inexpensive, it's easy, it's a no-brainer in a lot of ways, and I would like to see healthy schools available to every kid in every school, at least in North Carolina, if not all over the country.
Thanks, Meredith.
NC Impact is meeting the people who are working together to change North Carolina. Learn more about us at unctv.org/NCImpact.